Morning, good morning. And good morning to folks on Zoom. All right, I am just checking folks in on Zoom and then we will go ahead and get started. Actually, we're going to start with an activity. So I can actually share that with y'all. And then I can do the check-in while you guys are working on that. All righty. So I want everyone to go to this link, tinyurl.com/102mindbody. I'll open it over here. I have the tiny URL up here again. And then what I want you all to do is to type your answers in here. And as you type your answers, start by saying your name, just so I can see who's participating. So the questions are, where have you seen examples of how what's going on with your mental health influences your physical health and vice versa? What coping mechanisms work for you when you're stressed? What coping mechanisms have you tried that have not worked? And then what's one thing you can do as we head into finals to keep your mind-body connection and stay healthy? So as you do this, so for example, if I was going to do it, I would say, Dr. Myers, and I am stressed. I feel pain in my shoulders and back. So things along those lines. So go ahead and put your name and then your answer for each of these. Yes, I can put it in the chat, but y'all can also just, I always do the tiny URL so people can find it pretty easy. There you go. So I'm going to give everybody a few minutes to work on that and type in your answers. Type one in for all 4 questions. And then while y'all are doing that, I'm going to check everybody in. And also, I'll just say a reminder now. I'll try to send out an email today as well. Monday, you must be in person to pick up the exam. Great, I'm loving seeing y'all populate answers on all of them. So yeah, try to answer all 4 questions. I'll give you all some more time to do so. Sometimes it's helpful to see what works for other people. Looks like folks are wrapping up. If you're still typing, feel free. But I'm gonna go ahead and start reading our answers. I love this. Thank you all for sharing. And so what are physical and mental health connections? A lot of people started to say that you feel like sick to your stomach or nauseous when you're stressed and anxious. That's pretty common. Hands starting to shake, headaches, bouncing legs and fidgeting. Yeah. A couple people said your hands start to shake and going really quiet. Yeah, right. Just shutting down. I remember one time when I was in therapy, I just had a day where I just like couldn't say anything. And my therapist was very respectful and understanding and gave me space for that, which was lovely. But yeah, that can happen. Bad headaches, focusing on other things, right? I can't focus on what you're doing. Yeah, for sure. Oh, this is a really good example of, getting other physical things like breakouts, right? That can happen to folks. Some people, when they get so anxious or stressed, will actually get hives, like breakout in hives. So coping mechanisms that have worked for you, breathing exercises or removing yourself from the situation. Yeah, that can be super helpful. Music is a huge one for folks, right? Whether it's playing or listening to music. Drawing is a big one for folks. Watching favorite TV shows, just being able to kind of like dissociate almost, right? Stepping away from what's stressing you, playing games, reading, fun reading, I'm assuming. Yeah. Make a list of what you need to get done because it helps you visualize. Yeah, sometimes it's really helpful to like make a to-do list and like put stuff on it that you like just finished so you can check something off, right? And feel like you're accomplishing something. Planning, doing planners, yeah. Breathing, music, editing a video, love that. Going to the gym, a couple of people said that. Hanging out with friends, yeah, that social aspect can be really helpful. Things that haven't worked, some of these grounding exercises, I'm guessing that's what you're saying too, Chaj, so the G3 thing. Yeah, some of these just like won't help you when you're really stressed out, right? Breathing exercise is not working for folks. Meditating doesn't work for some folks. I'm horrible at meditating, full disclosure, as a therapist who used to do it with my clients. I'm just bad at it. And that's like very judgmental, and you're not supposed to be judgmental when you're meditating. But just full acknowledge I have a really hard time with it. Counting to 10 doesn't help. Yeah, trying to just get everything done and like not taking a break, but also maybe sometimes when you take a break, you feel like you're wasting time. So that can be really hard. Writing down how you feel in your notes on your phone. Yes, sometimes that's helpful. Sometimes it's not. Ignoring it. Yes, thank you, Nathan. That could be huge, right? That was just something that's not helpful. And things that you talked about that we can do over the next weekend or so as exams come up, and I love these. Sleeping, and people underestimate this, but like trying to let your body rest, even if you can't fall asleep, just like letting yourself lay and not be up doing stuff can be really helpful for recharging. Preparing early, yeah, so not cramming the night before. Using time efficiently, managing time, a couple of folks are saying. Taking time for your body and mind, love that. Yeah, for some people, meditation does work. So, making sure you're putting in what does work. A lot of people are saying sleep, using planners, and eating. Oh my gosh, eating is so important. Again, as someone who studies eating disorders, clearly I know this, but like you have to fuel your mind just like you'd fuel your body if you were going to go like run a marathon, right? I remember I took organic chemistry at college, and for whatever reason, chemistry and we just never clicked. And I was studying for the final and just like refused to go to the dining hall. My coach was like, no, I need to study. And very luckily, my boyfriend at the time, like, we weren't allowed to take food out of the dining hall, but he snuck me some out in like a coffee cup so that I would eat something. And then I realized like, oh yeah, I need to do this, right? And so that's really, really important to make sure you're resting your body and mind, but also fueling your body and mind. Excellent. Thank you all so much for participating in this. All righty. So the last topic we're going to touch on, thinking about health psych, is one that I think is really relevant still, unfortunately. And that's thinking about infectious diseases. I'm going to use COVID as an example, but we could certainly substitute like the flu here, right? Unfortunately, like bird flu is kind of looming as a potential risk, right? So we can use COVID as an example to think about how these major infectious diseases affect us both physically and mentally. So brief video on what COVID actually is here.
So the whole family of coronaviruses are named coronavirus because corona means crown. And so this refers to the way that the virus looks under the microscope, like there's a crown on the top of the virus. Some of them, 4 or 5 different kinds, cause common diseases among humans. Everything from the common cold to mild or moderate respiratory illnesses. Other kinds of coronaviruses affect animals. And sometimes, on rare occasions, we see coronaviruses jump from animal species into the human population.
And that's what happened with COVID.
The 2019 novel coronavirus is getting a lot of attention now because it is a new kind of coronavirus we haven't seen among humans before. The theory is that it may have jumped from an animal species into the human population and then begun spreading. We have seen some people that have died of this disease, and we know that there are already thousands of cases. So people are concerned.
And so this is a older video, obviously we know there were millions of cases. At that point, we didn't really know much about how it spread or how dangerous it was, but the interesting thing about COVID is the physical symptoms are very varied, right? And this can depend on your own body's immunity, but also the strain or mutation of the virus. So your symptoms typically appear somewhere within 2 to 14 days after exposure. I tend to be on the 14-day side. I've unfortunately had it twice, and in both times I thought I missed it and the rest of my family had it, but then around day 14 I was like, dang it, and I got symptoms. But other people get it really quickly. And possible symptoms include fever, chills, cough, shortness of breath, or difficulty breathing. Obviously, when this is severe, this is scary. This is what you need to be hospitalized for. Fatigue, muscle or body aches. So a lot of things that feel like the flu, right? Headaches. One that's kind of unique to COVID is the loss of taste or smell, right? My husband had this the first time he had COVID. He lost his sense of smell. And like a week or two later, we were walking around the neighborhood and he was like, oh, someone's burning leaves. And I was like, you can smell. And he was like, I can smell. But that affects your ability and your desire to eat, right? If you can't taste anything, everything just sort of feels like mush. Sore throat, congestion or runny nose. This is like the hallmark symptom for both my daughter and I. Just our noses run constantly the 2 times we've had it. Nausea or vomiting, diarrhea. So lots of things going on there. So one of the really interesting things, sort of in contrast to our initial ways we addressed this, is that initially we thought COVID was like a lot of other viruses and it was spread by droplets. And so this is why you saw all the things about stay 6 feet apart. Because if it's spread by droplets from your mouth, droplets from your nose, then if you stay 6 feet apart, they will have dropped off by then. What we discovered as the science advanced and we studied it more is that COVID is actually an aerosol. And so what this means is it's an even tinier particle and it can float in the air for hours. It spreads more in the air, it hovers more. And it goes way beyond that 6 feet that people were talking about. And this is one of the reasons why it spread so quickly, right? Is because it was just hanging around in the air. So this is really interesting. So I spent some time this morning looking at this. This was in 2022, the CDC's infographic. What do you do if you get COVID? So you watch for symptoms, you want to wear a mask around others indoors, you test, and then you follow isolation guidance, and then you take extra precautions, especially around people who might be more sick. Well, ever since then, it's gotten way more complicated. So what do you do if you have COVID, right? So it's a lot more nuanced in terms of what they're telling you to do. Although some of this are just good common sense, right? Like washing your hands, we should do that anyway. One of the funniest, saddest things about the beginning of the pandemic is they were finding it when they were still having events, had sporting events and things like that, the lines for the men's bathroom were just as long as the lines for the women's. And that was because they were washing their hands. Apparently they had never washed their hands in the bathroom before that, which is a little disturbing. But things like cleaning your high touch surfaces. One thing that's not on here, but seems to be really, really effective because COVID is an aerosol, is using high quality air filtration systems. So having a HEPA filter, things like that. When I had to have a rental car, while my car was being worked up, it's finally fixed, yay. But the rental car space was very small, so they had a pretty strong HEPA filter going in there to protect themselves, honestly. staying home, wearing a mask. Again, this avoid people who are vulnerable. And then this is my favorite. This is like the worst infographic I've ever seen. Don't make yours look like these. It's just like way too much information and really hard to follow, right? And so, you know, we've made the directions much more complicated because employers have put a lot of pressure on the government to encourage people to come back to work sooner. And B, it's just more nuanced in a lot of ways. So what were the global health implications? And this was really interesting. I was trying to find up-to-date numbers as of now. But as of April, the World Health Organization actually stopped trying to track COVID deaths and COVID cases because they're just not being reported anymore. So it's hard to report on something that like countries or governments are not collecting numbers on. But as of April, these were the numbers worldwide. So there were 705 million cases, and then 7 million people have died as a result of COVID. And that, like, if you take a second and just like let that number sit and sink in, that is devastating, right? So when 9/11 happened, around 5,000 people died. And like the whole country was just wrecked by it, right? And so I think as we let this sink in as a world, as a nation, we will be more overwhelmed by it. These are the global numbers for deaths. And I got them from this great website where you can like look at different countries and whatnot. And then these are just the confirmed deaths of COVID-19. So ones were like on the death certificate, they said COVID-19. Just like with HIV/AIDS, sometimes they're reporting you died of something else. Like maybe you died of pneumonia, but you got pneumonia because you had COVID, right? But these are the confirmed ones. And again, that 7 million number, you could see quite a few in South America, North America, Europe, and Asia. And I think the reason China is excluded is because their government has been very reluctant to report numbers. And it's also the place where it originated. So as of, again, April, because they've stopped counting, in the US, there were 112 million cases and 1.2 million deaths from COVID. And these are the US. These are daily excess deaths, which sounds weird, it's a really weird metric, but it's basically like people who wouldn't have died otherwise. Some people who are older or already sick, you could say like, oh, well, maybe they would have died anyway. But as you can see, there are quite a few and some really bad spikes that people had in terms of it. And it has trailed off, but it's not zero. What are the mental health implications of COVID and of everything we went through, especially in 2020? We saw increases in mental health utilization and mental health issues during the pandemic. So more people were experiencing symptoms of psychological disorders, but also more people were using therapy. And I think this reason is twofold. Not only did these folks have, you know, probably more symptoms, right? Because isolation is hard, the virus was very scary, anxiety provoking, but also the fact that like therapy was now being offered remotely much more consistently made it much more accessible for folks, right? And that helped. We know there are a lot of implications for mental health from long COVID in particular, which we'll talk about on the next few slides here. Actually, after we look at this. So what happens to your brain with COVID? This is something I was particularly interested in as I was like researching this post-COVID, right? Because can it cross the blood-brain barrier? At first they were saying no, like it can't affect your brain because it can't get into your brain. Later research shows it does do that. It does actually go into your brain. So it can enter into your bloodstream in the brain capillaries, those really small blood vessels. and it can increase and activate a lot of things. It will basically mess with your neurotransmitter regulation, deplete neurotransmitters like serotonin, dopamine, and norepinephrine. We know all of those are related to things like depression, psychosis. And so they also have altered neurotransmission and damage of the neurons, which is problematic, obviously. And then what you see is the neuropsychiatric symptoms. So people who have long COVID, or who, like, COVID has affected their brain, they'll have trouble paying attention. They'll have cognitive deficits, which include like memory issues, word finding issues. They'll have new onset anxiety. We'll see suicidal behavior. As I mentioned, depression and psychosis are two things really affected by those particular neurotransmitters, and some people are even having seizures as a result. So COVID has real implications for your brain. And honestly, like, this more than anything else, is what has kept me masking, because sort of my worst fear as someone who studies the brain, teaches about the brain, it values my brain, is having cognitive deficits and like not being able to express what I can actually experience. So this is scary to me. This is an actual under microscope screenshot, I guess. I mean, it sounds so funny to say it, but this is a microglial nodule. Glial cells are the helper cells in the brain. So it's a dense collection of activated microglia in the brainstem of a COVID-19 patient. These microglia are the brown things, and they're adjacent to two neurons. So these are the two neurons right here, the two asterisks. And so basically glial cells are good, but just like anything else in our body, if there's too much of something, that's bad, right? And so it's essentially starting to like clog up the brain. Let's say these two neurons need to communicate with each other. Now they can't, right? And that's problematic. All right, so here is a video about this, and this is in healthy young adults, so folks like yourselves.
We are about to begin a study of effects of infection with the 2019 novel coronavirus that causes what's known as COVID-19. This study is focused on an area that many people may not think about when they think about COVID. People who are younger, in the range of 18 to 35 or so, people who are previously healthy, people who did have the COVID-19 disease, but at a mild level. So they never needed to go to hospital. And we're then looking at actually how the virus potentially affected their brain and what those implications might mean for the long run. Now, that is something that may come as a surprise to many people, because again, we don't sort of reflexively associate COVID-19 with brain effects, but actually very early in the pandemic, it became clear that infection with this virus does have effects on the brain.
With the advent of the vaccine and some changes in the SARS-CoV-2 that's circulating, we see less death and severe disease and admissions, which is great news. What the public may not realize is that they can still develop mild COVID, and that can result in long COVID. And this is what occurs after recovery from the infection. 60 days, 90 days, 6 months later, you have persistence of symptoms. And they could be pulmonary, exercise tolerance is not below what it was, cardiac, or neurocognitive, which typically manifests as loss of memory, unable to concentrate. Some studies say this occurs in 30–50% of people who had COVID-19. What's really interesting is that it can occur in people who had very mild COVID-19 and no other medical conditions.
So again, really quick, emphasize what you said, 30 to 50% of people who had COVID may end up with long COVID. That's huge, right? That has a lot of implications for our global population.
And what is very powerful about the study is Michael Lipton and his group had very in-depth neurocognitive testing and neuroimaging of healthy residents of the Bronx. And so when the pandemic emerged, and we started to hear anecdotally that patients were having problems with memory, concentration, we thought we could re-study this group. And this is a very powerful study design because any changes we see, we can attribute to COVID-19.
The way we're going to go about doing this is by turning to a cohort of hundreds of patients who were examined and were healthy prior to the onset of the COVID-19 pandemic because they participated in other studies at Albert Einstein and Montefiore. And those are individuals for whom we now have a very clear baseline of what their brain looked like through MRI scans, what some of their blood chemistry looked like, and what their brain function looked like.
And the reason that we need to study this is that it's going to affect a large percentage of the population. And one thing that we're worried about is if there's any inflammation or damage to the brain, will this result in something that happens 10 to 20 years down the line in terms of loss of neurocognitive function? So we don't know what it means. You have long COVID now, and what are the implications for your health 10, 20 years later on? This kind of study is going to start to answer that by asking, how does it actually manifest that I can measure in terms of neurocognitive testing or imaging? How long will it last? And in our case, we're studying 3 years. And the other thing that we're trying to do is develop biomarkers. So from all of our patients, we're going to collect blood, and in patients who have clear changes, we're then going to study to determine if we can figure out blood biomarkers. Again, this can be used to study the general population. We can use them in case we have interventions to see if they're responding to therapy.
So like, not only will that let you, as she just said, like if there's medication that you can give that might address those biomarkers, but eventually it might mean we can do a blood test and like test for long COVID, right? Rather than sort of guessing.
In designing the currently funded study, we did do some preliminary testing, and we know therefore that while very preliminary, that there do seem to be some demonstrable trends which show that individuals who had the coronavirus infection, and again, were either mildly symptomatic or asymptomatic, compared to individuals who did not, show a modest but clear decline in measures coming from MRI of their brain structure that are consistent with inflammatory changes in the brain in terms of areas of cognitive function, like memory and attention and information processing. There is a spectrum of severity. Some people may have, with the same disease, a more severe manifestation. Some may have a less severe manifestation. Some may have the same disease going on in their brain that is actually subclinical, meaning they don't notice any symptoms, but it could be at a very low level. The same inflammation is going on, not at a severe enough degree to cause symptoms now, but could be a harbinger of future brain dysfunction down the road. That's why understanding mechanisms and potentially developing targeted treatment are important to try and head off future, obviously, clinically significant problems in people who right now may have lower levels of change in the brain.
What I find interesting about SARS-CoV-2 is this persistence of symptoms. For me, as an infectious disease physician, that's very unusual. And we do see in some of our patients that have persistent symptoms, it's really affecting their day-to-day life in terms of their thinking, their ability to think, their memory, this feeling of mental fogginess. some patients aren't able to exercise as they did in the past. And I would tell my patients that as transmission rates rise in the community, you can do something very simple, which is put a mask on. Because we don't know who's at risk for long COVID. So I would suggest keeping an eye on transmission levels in your community. Put that mask on. I think we're all kind of used to it at this point. I would use the N95, which are better at preventing transmission. And if we need to get additional boosters coming in the fall in case rates go up, I would do that. We want to try to prevent being infected. We don't want to have a risk of long haul COVID. We don't want to infect our family and friends.
Yeah, and so making sure that you're getting the latest version of the vaccine can be really important. And again, if rates go up, masking is not a bad thing. If y'all are gonna be flying or traveling in other public things like a train, might not hurt to throw a mask on, just to keep yourself from getting like the flu from other people too, right? So these are just some examples of research on mental health related to COVID. So the National Institutes of Mental Health launched a 5-year research study called Recoup New York to promote mental health of New Yorkers from communities that are hard hit. Another NIMH-funded study is examining use of mobile apps to address mental health disparities. The Kennedy Shriver National Institute of Child Health and Human Development is funding research to understand the effects of mask usage for kids, including any impacts on their emotional and brain development. NIMH is looking at the impacts of the pandemic on underserved and vulnerable populations and on the cognitive, social, and emotional development of kids. The National Institute on Alcohol Abuse and Alcoholism is funding research to look at how this might affect alcohol use and abuse. And then there's a collaborative study between NIMH and the National Center for Complementary and Integrative Health to understand the stressors affecting people during the pandemic. And these are just large-scale funded ones. There's so much other research going on as well. So what we see is, again, it's like 30 to 50% of people who were infected with COVID get long COVID. There are still plenty of folks who just never got COVID. And approximately 1 in 5 adults ages 18 plus that have a health condition that's probably long COVID related to their previous COVID-19 illness. So we just heard about the neurologic and mental health conditions. They mentioned the cardiovascular conditions. So we have fairly young, healthy folks who all of a sudden are having heart attacks after COVID infection, kidney failure, respiratory conditions. We know that COVID really affects the lungs, musculoskeletal conditions, and also blood clots and vascular issues. So what are the most common symptoms people are reporting? Fatigue and shortness of breath persisting, but that joint pain, chest pain, cough. For some people, their sense of smell and taste just never come back. And then for other folks, it's like a headache. It is sore throat, vertigo, or just constant diarrhea. Oof. These are symptoms after month 7. So fatigue, just malaise is like another word to say depression, brain fog, sensory-motor symptoms, headaches and related symptoms, memory issues. Like you see how many of these are psychologically related, right? Insomnia, muscle aches, speech and language issues, that shortness of breath, that joint pain. Tachycardia is a heart symptom, tightness of chest, other sleeping related symptoms. So basically all strains of COVID-19 can cause long COVID. And again, we don't know how many, might be 10%, might be 30%, might be 50% of people who are infected with COVID then develop long COVID. Vaccination not only reduces your chances of getting COVID, but it actually seems to reduce your chances of getting long COVID if you are infected with COVID. So you need to get vaccinated and boosted, wear your masks to reduce transmission, and look at your own community's risks. So how has our response been flawed? Well, in a couple different ways, and these are consensus statements from really well-respected journals. And so this is a commission from The Lancet, a British medical journal, that talks about, it's gonna jump in and out apparently, that talks about essentially we need to kind of get ahead of something like this happening again, right? Work together, build up programs for dealing with epidemics and pandemics. They're sort of like, who cares how it started? We were too cautious and too slow. We need to, and governments were too slow. Essentially, we need to act faster. And then epidemic control was seriously hindered by substantial public opposition to routine public health and social measures such as masking and getting the vaccine. Right, so we just need like public health and critical thinking education. Public policies didn't properly address the unequal effects of the pandemic. The American Psychological Association during the pandemic very clearly talked about this. They talked about there being an epidemic of racism, right, as well as COVID, and that affecting people. Rapid development of vaccines has been a triumph of the research and development system, but we need to have a multilateral coordinated approach by governments, right, to make them available to everyone. Economic recovery depends on sustaining high rates of vaccination coverage and new rates of infections. And the sustainable development process has been setbacks several years. Because essentially everything got put on hold, right? And money has got diverted. And this was essentially consensus statements they gave to a whole bunch of really involved folks that said, okay, which of these are important? And what you'll see is that a lot of folks are saying, yeah, the volume and velocity of information during the pandemic made it hard for people to assess information. So maybe we need to be more careful about how we distribute information. Sources of false information undermine the social cohesion, obviously. The government's decision to reduce the COVID-19 pandemic control measures does not mean the threat to public health has ended. Very, very true. Things here like there continue to be systemic risks of COVID-19 infection for healthcare workers in many healthcare settings. It continues to reveal vulnerabilities in the global supply chain. If you remember 2020 and after, like, you couldn't get masks like this one because they needed to give them to healthcare workers, right? My folks were in the middle of building a house and that got delayed because like they couldn't get building supplies. So this has economic implications as well. And then some of the ones here discussing vaccine hesitancy as a primary function of information or worldwide worldview is inaccurate, as vaccine hesitancy is a multifactorial phenomenon with lots of different factors. And vaccination alone is insufficient to end the COVID-19 pandemic. Yeah, we need to stay alert, try to reduce transmission, things along those lines. And so these are basically things that folks came out of the COVID-19 pandemic with, like, here's what we can do better next time. So improve primary healthcare and universal access to healthcare is just like a baseline, right? If you didn't have a primary health doctor when you got it right before the at-home test came out, it's like, where are you going to go to get a test? I would just call my doctor. I would pull up my car to the back of their office. The nurse would come out dressed in all their PPE, swab me in my car, as I said, touch my brain, right? And then I would get the results later. I want to scale up community-based public health systems. Investment in public health and scientific literacy, so important, right? So that people believe the accurate information and learn how to dismiss the inaccurate information. Inclusive, diverse leadership at all levels, so that we're thinking about things like gender, things like race, things like socioeconomic status. Investment in supporting scientists to present evidence more effectively. Investment in behavioral and social sciences research, hey, psychology, to develop and implement more effective interventions and policies to change behavior. Protection of vulnerable groups. Establishment of safe school, workplace, and public spaces, including investments in ventilation and filtration. Like, this is what should have come out of the pandemic and didn't, right? So like when cholera or other diseases borne by water came out, we did a lot on water safety. We should be doing a lot on air quality safety. We're not, and that's a problem in my opinion. Permission for schools to implement stringent and evidence-supported control strategies early in an outbreak situation. So prioritizing in-person learning, but all the kids have to wear and like keep on their masks, right? If you're sick, you do not come in the building. Universal access to digital services, social support services. So having like mental health care, having social services, social workers, national and global supply chains for things like PPE, vaccines, testing, global coordination and standardization of data collection, application of a gender responsive approach to pandemics, in terms of testing, in terms of like, one of the things that happened is that like women were more likely to be the ones who had to quit their jobs to stay home with their kids who were virtually learning, right? So figuring out how to like eliminate that inequity. And universal adoption of updated medical, scientific, and public health training and airborne infectious disease exposure standards, right? We know this is airborne. We know it's an aerosol. What can we do to start protecting against aerosols in the way that we've learned to protect against droplets? So this is an activity I had. We won't have actually time to do the whole thing, but this is something you can do on your own if you're interested, is to think about like, what are the COVID-19 related claims on social media? Give you some examples, right? People say, oh, COVID is over, no one's getting COVID anymore. Not true. A more horrible one that was really popular right when the vaccines came out was, how did they phrase it? The vaccines are full of aborted fetuses. Not true, right? Some people wouldn't take them for that reason. There's a microchip in it that Bill Gates is gonna monitor you, right? Like at that point, I was like, let Bill Gates know that I'm at Target. Because I haven't been able to be in Target in a year and a half because I'm very vulnerable because of my health conditions. So I just like didn't go out in public basically until I was fully vaccinated. So yeah, and then there's ongoing ones about things like bird flu. Thinking about the fact that like there's an uptick in people wanting to drink raw milk right around the time that like birds are starting to infect cows, right? And so then like humans might get the bird flu through drinking raw milk. Like pasteurization exists for a reason, so we don't die, right? So just something to think about for yourself. And if y'all are here, y'all will get points for this because we didn't have time to get to it. All right, again, reminder, be here in person on Monday to pick up exam 3, which will be due at the time of our final presentations for the infographic. All righty, have a good weekend, everybody.